Hey guys, Wendy Petrus here with Building Futures, and today I would like to talk to you about a whole child approach and what that means. As parents oftentimes wonder what that really is, and so I want to define that a little bit. So when you come here for therapy, we do look at the diagnosis, and that tells us a lot, but we want to go further than just the diagnosis, and we want to look at the whole child. We know that communication, social skills, emotional regulation, movement, sensory integration, all of those things work together and they're connected. So when you work on one, you benefit the other. For example, when a child comes in for a speech therapy, maybe we're working on communications, their words or sounds. We're not just going to work on that, but we're going to look at how is their attention, how are their play skills, how do they interact with other people, and how do they understand the information that they're given. And when we address that, we make so much of a bigger impact on their progress. Or if you want to take handwriting, for example, they come in for occupational therapy, we want to look at their strength, their posture, sensory, or is there anything going on that's sensory involved. We look at all of that and not just the obstacle that we're presented with. A whole child approach is opposite of a cookie cutter approach. So a cookie cutter approach looks at every child and uses the same exact approach in every situation. And so the whole child approach would look at two children, and although they present with similarities, we know that they respond differently to play. They have different challenges. When you take a child that has this unique plan that's tailored to them and specific to their interests, it becomes meaningful to them, and suddenly it's not just a goal. The whole family is involved, and there's meaning behind it. And when there is that meaning behind it, you have carryover of skill. That's another thing that really makes the whole child approach so successful is that it causes that carryover to happen. You're not just looking at a child in a therapy session. You're looking at how does this impact them in their community? How does it impact them at school, at home? You're looking at all that, and when you address those skills, carryover happens, and that is what makes a successful plan of care. So if you have any questions, if any concerns, we would love to be a part of your journey and help you however we can. Just reach out to us.